is Teresa Tejada, and I'll start sharing my screen. Welcome to our Vaccine 101 conversation today. Both Amiris and myself, we're part of the REACH team at the National Kidney Foundation of Michigan, and we'll talk a little bit more about like what is the Kidney Foundation doing and what's REACH a little bit later. So really appreciate you being here. We have been in this pandemic for some time now, and we've heard a lot about the different types of vaccines, and so this presentation will help clean up some of those misunderstandings, fill in some gaps, help us to be more knowledgeable about how vaccines are developed and what they do, because we know that a lot of people haven't gotten vaccinated or don't get vaccinated year after year for the flu or other things too, because they either just don't trust vaccines or don't trust the medical system or the government. And so, we hope that with sharing some information, just making sure we kind of learn a little bit more about like the history of vaccines and, how they develop and what do they do, we can and to start feeling more comfortable to have those kinds of conversations and build that trust a little bit more. And look about this long-term safety and efficacy of the vaccine. So we just kind of want to lay the groundwork of the basics so that we can feel more comfortable in having some difficult conversations. So by the end of this presentation, you should have an understanding of the similarities and differences between flu and COVID, why we vaccinate, some basic history of the vaccine development, how vaccine prevents disease spread, and some common concerns related to vaccination. So why should we be concerned? So flu and COVID-19 viruses are serious. They can have some very severe complications, and we both know that they can spread really easily too. We haven't reached herd immunity yet. The virus is still spreading around. It's mutating. We've heard about the Delta variant. And so, those chances of having those serious complications are still out there. The flu is also very serious, and we'll talk a little bit more about that later. And we've seen through this, past almost 2 years that it affects the way, affects all of us. It changes the way we interact with each other, spending a lot more time at home, like in this Zoom setting for this kind of presentation. Schools and businesses have been closed. And it's put a strain on the healthcare system too. We see that ICU beds are kind of filling up, that the medical staff is getting really burnt out. And that can really have implications for not just people who have flu and COVID, but other people who need to use healthcare services if they have like a heart attack or break an arm or something like that they're not able to get the type of care that they need. And so vaccines are one way that we can help protect both yourself and society, along with some other types of techniques too. So we're concerned because we have all these big picture things that are going on, and vaccines are one way that we can help get back to life. So just as an overview, this is probably very familiar. Some of these concepts are very familiar to a lot of us. Here are some common facts about the flu and COVID, and what are some of the similarities and differences between these two, both respiratory viruses. They both can have some severe complications. They are transmitted by respiratory droplets from an infected person, and both though have a vaccine that will help prevent them from spreading. So some of those severe complications of flu and COVID can be things like pneumonia, and then worsening of some chronic medical conditions that we might already have, like kidney disease, which is why we're concerned too. Blood clots can be a factor or a complication from COVID-19, and it can affect some major organs like kidneys. We've seen that. And so we've also seen too that COVID can also cause multi-system inflammatory disease in children, which we're still learning a little bit more about that too. And also COVID can cause long haul COVID or long COVID, which causes some fatigue and confusion and some other types of symptoms too, and other concerns long after someone has recovered from the immediate infection of COVID. So that's something we're still learning a little bit more about. So everyone is at risk for either disease. With the flu, both young, very young people and and our elderly community members are at risk for some severe complications from the flu. And then with COVID too, individuals who have a chronic disease, who may be obese, are also more likely to be hospitalized or die from the virus too. So with the vaccines, like we said, you can't, they're distinct. They offer different protections. So the flu vaccine won't protect you from COVID, and the COVID vaccine won't protect you from the flu. You need to have two separate vaccines. And then COVID-19 also comes from a family of coronaviruses that can cause a variety of different types of symptoms, from a common cold, or some more severe things like MERS or SARS. But this is a unique virus, the COVID-19, the SARS-CoV-2 virus. But since it has from that family, and like flu is also from a family of influenza vaccines, we kind of know a little bit about how they develop and replicate in society. But you can also see that as it replicates and mutates throughout society, that can cause, every time that it copies itself, there's a chance for a mutation. And that's where we get things like the Delta variant, which we hear about. So just wanted to give some statistics about how COVID and the flu or influenza have affected us. So as of September 10th, in Michigan, there have been over 970 COVID-19 cases. So that's like way more than the city of Detroit population. And there's been over 20,500 deaths, which would be, we could fill up a hockey game at Little Caesars Arena of the people who have passed away, unfortunately, from COVID-19. And so, a lot of us know people who have had either sadly passed away from COVID-19, or who have been able to, been affected by a COVID-19 infection. So we are at currently, or actually as of September 10th, we were 66.3% vaccinated too, which is lower than the national average. And then for flu, we took some data from a couple of years ago, where, again, it can be very serious and widespread, over 42.9 million cases across the country, which led to different medical visits, and up to 647,000 hospitalizations, and up to 61,200 deaths from the flu. So when people are like, oh, it's just the flu, it can be very serious. So we have a variety. So why is the Kidney Foundation involved in this? So at the Kidney Foundation, we want to try to create, not only support individuals who have chronic kidney disease, but try to create healthier communities in general, so that people don't have chronic kidney disease. And like I had mentioned before, that COVID-19 can have a big impact on your kidney health. But also through a lot of our different programs and strategies, like our REACH grant, we want to try to create healthier communities so that people can have access to healthcare, access to healthy food, access to safe physical activity. And so with our REACH grant, we're trying to work on reducing some health disparities. And so we were asked by the CDC to help do vaccine outreach, because we know that there's some disparities among people who get vaccinated for the flu and for COVID, and there's some racial and ethnic disparities, which there's some real justifications for why some people might have some concerns about that. So since we're working at a community level, we wanted to just try to get that information out there, train people like you who are influential within the community to share information and make vaccination a little bit more available to communities. And so, This slide here, it's called the Swiss cheese model, and I like it because, you know, vaccines are a very important tool in our toolbox, but they're not the only tool. And but so things like masking and washing your hands and physical distancing and all that kind of stuff, those are also important tools. But vaccines are probably the most misunderstood, and so that's why we're going to focus on that today. And also they can, you know, some of these things are kind of really severe, right? Like just staying at home all the time. Well, we probably won't get COVID that way, but you know, we miss people, so we want to go out, and things like vaccines can help us to get there. So just a little bit of basics on how immunity works. So there's two ways. So immunity exists when an exposure to a disease triggers our body's immune system to produce antibodies to that disease. So those things that can kind of help protect us for when we see that virus in the future. And so you can get it through two ways: natural immunity or vaccine-induced immunity. So on the left, we can see all these different types of pathogens, or these different types of like viruses and disease that come with us. And they have these different types of characteristics, these antigens that are unique. And so antibodies, when they're created, they can kind of, you know, figure out how do you attack those antigens, and what are those unique ways that we can kind of really attack the pathogen. So in a natural immunity, you know, you get exposed to a virus, your body creates the antibodies to defeat the pathogen. For a vaccine, you don't get the full, not the full virus, but maybe you'll get either, depending on the type of vaccine and the disease it's trying to affect, you'll either get maybe like a weakened part of the virus, or a fragment of the virus, or a dead part of the virus, that you can, the body can go and look at that antigen and create some of those antibodies specifically for that. But you don't really have the actual disease yourself. And so then in the future, when you're come across that specific signal or characteristic of that virus, your body's already knowing how to protect yourself and how to attack it by having those antibodies in your system. And it can take up to 2 weeks after you get vaccinated to have that full build up of immunity and build up those antibodies and those signals of how to attack the antigen and the pathogen. And there are pros and cons to both natural immunity and vaccine immunity. So, you know, we want to get immunity so that when we can see that disease and get exposed to it in the future, you know, we can fight it with faster and with less severe complications if we get exposed, and either way can kind of, you know, help you do that. But with natural immunity, you know, it can provide some long-lasting immunity, but you get the disease, right? So you might have some severe complications from that, and you could still spread it to others too. So vaccine immunity also has some pros and cons with it. You still learn how to make those antibodies, but you might not develop long-lasting immunity. So you might need to have a booster. So you know, there's pros and cons to both, but when you have the vaccine immunity, again, you're not going to really you don't have the real virus. You're not going to spread it to others, and you won't have those long-lasting severe symptoms too. And we're still learning in terms of COVID-19, we're still learning about both natural and vaccine immunity. And it's recommended for people who have had COVID-19 and have recovered to get vaccinated, so that you have that type of protection, because we've seen that people are getting sick again, and evidence is emerging that people get better protection from vaccine immunity than natural immunity, even perhaps more than two times better protection, so that people who just have natural immunity are more than 2 times as likely to get COVID again compared to vaccinated people. So as a recap, so what do vaccines do? They give us the antibodies necessary to fight the new antigen in our bodies once we're exposed to it. It's not a force field. It gives us that protection to help, fight the disease, so that, if we get exposed to it, We'll have less symptoms or maybe even no symptoms at all. So going back to immunity for a second, we have this short video. This is from a series called Greater Than COVID, The Conversation, where it has a bunch of doctors and healthcare professionals of color that are kind of going over some of the common questions about vaccines, and in particular the COVID-19 vaccine. So just wanted to share this really great video that kind of explains what herd immunity is.
Herd immunity means that a certain percentage of people have antibodies to the virus such that they protect those who don't have antibodies. You can get it either by getting the COVID, which is not a great way to get antibodies. You get really sick from the disease, or you can get it from having the vaccine. They say that you need at least 70% of the population or herd to have antibodies to COVID in order for it to stop transmission of the disease and protect everyone.
Great. So if you have any other types of questions about the vaccine, this is a great website too. This betweenusaboutUs.org has really short snippet videos, like maximum 3 minutes, that answer some of those really key questions. So check it out, and English and Spanish too. So just wanted to give like a short history of the impact of vaccines, that we have our flu and our COVID vaccines today, but we know that vaccines are for a lot of different types of conditions. So we talked earlier about chickenpox, where it was once almost everyone had the chickenpox, but now it's a lot less common because we've got lots of widespread vaccination, where people are getting the vaccine and not getting the chickenpox. Similarly, polio. Polio was a very, very widespread disease, and it affected, many, many people very severely, including one of our presidents. But because of widespread vaccination, polio was eliminated from the Western Hemisphere in 1994. And I'm going to screw this up, but pneumococcal disease is again another one of those really severe causes of illness, but it's dropped significantly because we have vaccines. So they can have a real big impact on different types of our health of our population. It allows us to, kind of live longer and, hopefully healthier and better quality of lives. And vaccines have been, around with us, and the information about vaccine and the science behind vaccines have been around for a long, long, long time, since we started using, cowpox pus to protect us from smallpox. And as scientists have learned more about, this type of protection, and actually, vaccine, the word vacca in Latin is the word for cow. So that's how we got to the word vaccines. So, as we study science about, diseases and immunology and virology throughout the years, we learn more and develop new technologies to help us protect these diseases that have either been with us for a long time or that are new. So you can see that 1946, that's when the first influenza vaccine was approved for civilians. And then since the 1990s, we've been really starting to learn more about mRNA and mRNA technology, which comes into play with COVID. So how are vaccines developed? There are 3 phases of clinical trials that have thousands and thousands and thousands of volunteers, so that we can make sure that vaccines are safe before we, broadcast it into, the entire population. So we'll go a little bit into more depth about those different phases. So the first phase, and even before we get to humans, there's all this research and development that happens in the lab and with, other types of, animals too. So lots of information and research is done before it gets to the broad population. So for phase 1, we start up with a small group of people, and researchers try to answer these questions. Is the vaccine safe? Are there any sorts of serious side effects? And so how does the dose of that vaccine relate to side effects? So do we need to maybe have less or have more of the actual vaccine dose? And is it working? Is the vaccine causing an immune response? Then we get to phase 2 and we broaden that out a little bit more. And the researchers try to answer what are the common short-term side effects of the vaccine. Again, is it working, or is the body having an immune response? Are there signs that the vaccine is protective when you're out in the community and you might be exposed to it? Is it working? Then we take another phase, we have even more volunteers, and we just, again, want to make sure that it's working. So when you have those who are vaccinated, does that have a difference between the people who aren't getting vaccinated and those rates? So it goes through, if you have a placebo or if you actually have the real thing. And so how can the vaccine protect people from disease? And so after you gets through those phases, then it gets approved by the FDA and made available to the general public. But that doesn't stop, right? The FDA are continuing to monitor the safety of the vaccine after the public uses it to make sure we're still collecting the data on the vaccine's long-term benefits and side effects. So with the COVID vaccine, all of those steps were taking place. None of them were skipped at all, but we allowed to have like a little bit more condensed timeline. And we'll talk a little bit more about why the vaccine developed really quickly with COVID-19, but all of these phases happened. But we kind of have a little bit of a phase in between, and that was the emergency use authorization, which allows us to, the FDA was like, this is COVID-19 is very, very serious. We know that the vaccines are safe, and we want to get it out into the community to have that protective benefits. We think that the benefits are way more valuable than any potential risks. We have 2 months of data to show that it is safe and that it's working. And the full authorization comes with 6 or more months of data. And those 2 months are really important because with all, different types of vaccines and different types of vaccines, usually if there are any sort of severe adverse effects that come from the vaccine, like a blood clot or Guillain-Barré, that usually happens within the first 2 months. So if we would have known that there were going to be some really big, widespread safety issues, that would have happened really quickly. So that is kind of like the 2-month reasoning. Yeah. We'll talk a little bit more about that later. So approved. Again, people are studying vaccines all the time. That leads to different types of innovation, like the mRNA technology that we have been seeing with COVID-19. And we wanted to highlight Dr. Kazmikia Corbett here, who was really one of the leading forces behind the Moderna vaccine. And she had been studying, mRNA technology for a long, long time with different other kind of coronaviruses. And then once, scientists figured out what the genetic sequence of COVID was, she helped to apply that mRNA research that she'd been doing to COVID, and did some clinical research into lab animals, and helped to make sure that the effectiveness as it was went to humans as well too. So we definitely just wanted to highlight the faces behind all the vaccine and study research that's been going on behind the scenes. So, for flu vaccines, again, there's so much study and so much research that happens every year about the flu viruses. Scientists are kind of seeing what kind of flu strains are circulating throughout the community. And they do that genetic sequencing to just see again, like what's out there, and help to prepare the virus or the vaccines for the next year. So, the CDC works with different, vaccine manufacturers to provide those different types of vaccines that you can get at your local pharmacy or your doctor's office. And there's actually a couple different types of vaccines. There's vaccines that use eggs, vaccines that don't use eggs, nasal sprays, vaccines for, based on your age. And there's no real preference on, which vaccine you get. So you can talk with your healthcare provider if there is a different types of vaccine that you would want to, and how you can kind of get that too. All right. So how did the COVID-19 vaccines develop so fast? It was really a combination of many different types of things. So we've got modern science. We were able to do that genetic sequencing really, really quickly. Once they figured out what the COVID-19 virus was, like within like days, they were able to kind of do that sequencing. And it led to some collaborative efforts across the globe. Scientists have been working on, how can we develop a vaccine so quickly? 1 second, sorry, talking too much. Oh, I pressed the wrong thing. You got to hear my cough, sorry. So working together, scientists and, all the different types of vaccine manufacturers are working together to come together on a vaccine. Unfortunately, we were able to have lots of volunteers in that research because it was a global pandemic. And so you got to see how was the vaccine working in a real-time situation, where maybe with other types of illnesses that have happened, maybe they've subsided by then, or they were really only isolated in one area. So you really weren't able to get a comprehensive group of people to study if they were working. And the researchers made sure that there was a really big, robust, and diverse group of people who were in the clinical trials to make sure that it's representative of our population. And we were able to build upon previous research, like we were talking about with other coronaviruses, the mRNA technology. So it was really kind of like all this work that has been doing for decades, meeting good timing and meeting also, a financial investment from governments that bought vaccine supplies and ingredients and stuff like that in advance so that we could kind of roll it out quickly, and really investing into the technology for possible vaccines that could work and maybe didn't work too, because we needed to help do that research. And we talked a little bit more about that emergency use authorization too. So this is just kind of a timeline to show that those different phases and milestones that had kind of happened along the way with the development of the COVID-19 vaccine. So you can see again that no phases were skipped. We, did all of the different types of things that were needed, including the authorization of the Pfizer vaccine, the full authorization of the Pfizer vaccine. And we'll talk a little bit more about Pfizer, Moderna, and Johnson & Johnson a little bit. Or right now, but I guess before that, any sorts of questions so far? And this information might be old hat to you too. All right. So just again, like a side-by-side comparison of Pfizer, Moderna, and Johnson & Johnson. So Pfizer and Moderna are both mRNA, which means you need to have 2 doses. And Johnson & Johnson is a different type of a delivery mechanism of a vaccine. It's called a viral vector, so you only need 1 dose. But all the vaccines are available to the public, whether you have insurance or not, whether you're a citizen or not. This is a public health issue, so we wanted to make sure that it's available for everyone, and that all the vaccines have been shown to be protective against some of those severe infections where you get hospitalized or pass away, even with the variants too. It's a little bit less with the variant, the Delta variant, but it's still very effective. So how does an mRNA vaccine work? It's all about these spiky things. So the coronavirus, corona means crown. And so all those little spiky bits are what we're really focusing on, the crown with the vaccine. So those spiky bits are protein, and mRNA vaccines contain the instructions that cells need to make just what those spiky proteins look like. So when it's in your body it tricks your body to create an immune response against the spiky protein and build those antibodies. It does not change your DNA. It doesn't change your genetic code. It's only really that information about the spiky bit, so that you can have the tools to fight the disease. And so this is how the Pfizer and Moderna vaccines work. So a viral vector vaccine, or Johnson & Johnson, that uses a more like kind of traditional type of vaccine, where it gives you this a different type of virus called an adenovirus that it can't replicate, so it can't copy itself into your body, but it tells again that spiky bit. How can your body make some protective antibodies when it sees that little spiky protein? And so then you can have that immune response again if you see it and get exposed to it, of what you can do for that spiky bit. So side effects with a vaccine are common. They're common with side effects are you have it with every sort of medical condition that you might, in medical treatment, you most likely have a side effect. Most often it's mild and temporary. So both with the flu and the COVID-19 vaccine, you might get some pain and redness and swelling on the arm where you get the shot. I don't know if you guys got vaccinated and experienced that yourself. And then throughout the rest of your body, you can have some other types of side effects like tiredness, headache, muscle pain, chills, fever, and nausea. Most of the time, again, these are temporary and go away, over time. And if they don't go away, then make sure that you contact your doctor or healthcare provider. And if your symptoms get worse too, because there's this thing called VAERS, the Vaccine Adverse Event Reporting System. Like I said earlier, FDA is continuing to monitor the safety of the vaccines. And as we get into larger populations, what might be just like it might have happened, or if we noticed it in the clinical trial, maybe it happened to one person. Well, we maybe see that it's a big trend, or a larger trend than one person that we should kind of have keep notice on to see whether we need to stop giving out the vaccine, or prepare a treatment, or recommend a different type of vaccine for different types of people. So I saw that, for example, with Johnson & Johnson, that, and I'm going to quote the numbers here because it's important, that there were those blood clots that were noticed and reported earlier on when the vaccine happened. But upon further study, it's still super, super rare. So as of August 25th, there have been 14.2 million doses administered and only 44 confirmed reports of those blood clots. But we noticed that, okay, this is a thing. Let's, put a warning on it. It might happen, but still the benefits are way better than the risk because it's super, super rare. Or we might say like, oh, well, there's a trend. For example, there had been some reports about myocarditis, which is like affects your heart. We noticed that younger men, like under 30, were kind of having some mild reports of myocarditis that would go away. But and so in that situation, maybe a man would want to have a different types of vaccine that's still safe. But again, those are super, super rare. There have been, again, millions and millions and millions of vaccines that have been administered. And in the VAERS system, 1,377 reports. And only 798 of them have been confirmed of myocarditis. So we know that it can happen, but it's very rare. And you can report your own symptoms yourself through the V-Safe system. So can people still get sick even if they get vaccinated? Yes, but your chances of having a serious illness or death are drastically reduced. That doesn't mean the vaccines are not effective. It just gives you that protection. So that if you're exposed, you've got those antibodies. It's not a force field. So who should get the flu vaccine? Everyone aged 6 months or older, unless like your doctor says that, maybe you have a condition that might, where getting a flu vaccine is not recommended, and you should get it every year. And those flu vaccine priority groups, remember, are the younger our younger population and our elderly and individuals with chronic conditions are at risk of high risk of hospitalization or death from the flu. So get the flu shot every year, especially this year, because we saw all those protective measures that we put in place last year when we're all staying from homes, we're all wearing our masks, that there really wasn't a lot of flu that was circulating around. And so, as we talked earlier, immunity can wane and become less over time. And so we haven't really been exposed to the flu, not just 1 year, but 2 years or maybe 3 years, because a lot of people, we didn't have that circulation of the flu. So there are some, CDC is predicting that it might be a more severe and stronger flu season this year. So we want to make sure that we're getting the flu shot as soon as possible, recommended by the end of October. And who should get the COVID-19 vaccine? Everyone age 12 years and older. If you are 12 to 17, you can get the Pfizer vaccine under the emergency use authorization. And everyone who's 18 and older can get any Pfizer, Moderna, or Johnson & Johnson. And trials are going on right now for those who are younger than 12. So we just wanted to go over a few common concerns that we've heard at the Kidney Foundation about both what the flu and the COVID-19 vaccine are about. And you might have heard these yourselves or might even think about them yourselves. I know I said the first one too. I got the flu shot. I still got the flu. Why do I need to get the flu shot? Well, we know that, well, first of all, maybe it wasn't the flu, right? Some of those symptoms can be other things too. Or maybe you got exposed before you had that full immunity to the vaccine. Or maybe that it could have been a lot more severe and that the flu shot was working and giving you that protection from maybe having more severe complications like going to the hospital. So it could still be working. Another common concern is that the flu changes every year. That's those strains that we have in our flu vaccine. It's not very effective because it changes every year, and that's true. Like that, it does change every year, and sometimes we don't get it right. By we, I mean like not me, but I mean like public health in general doesn't get it right. But most of the time we do. So it's still better to have that types of protection from the flu vaccine and to give you that extra protection. And a lot of people think that the flu is not that big of a deal, but as we talked earlier, it can be very, very serious and lead to hospitalization and death. And or even just like lost work, right? That if we don't have health insurance or in our busy lives, we really don't, a lot of us don't really have time to just take a couple of days off to deal with the flu. So it can be a very, very big deal. And again, we've done some research into the community about some common concerns about the COVID-19 and the COVID-19 vaccine. And we found that insurance was an issue, a concern for many people. And again, the vaccine is available for people who do or do not have insurance. Another concern is about, how will we know that 10 years down the line, we won't have any long-term side effects for adverse events? And like I said before, that research has shown with most other vaccines that if there's something severe will happen, it'll be within the first 2 months, like we've noticed even with COVID-19 vaccine. We've heard some people have comments to say that young people aren't going to get sick, and that was kind of true at the very beginning, but we've seen more people recently have severe complications from COVID-19 and are in the hospital and are unfortunately passing away. But also too, even if you don't have those severe symptoms, we don't want to pass it along to someone who might be more vulnerable to having those severe complications. So that's another important reason why we need to be, protected. And then people just don't feel like that they don't want to be like a guinea pig or a lab rat, that this is all new. And it's, you know, it's understandable to be uneasy with new treatments. We've been in this pandemic for a while now, and there's just like so much anxiety that comes with that. And we've had to make a lot of change our lives and uproot a lot of different things and make lots of different types of decisions. We know, you know, like as we talked about earlier, that like the mRNA technology has been around with us for a while. Millions and millions and millions and millions of people in the United States and around the world have been getting the vaccine. Most of them have had no sorts of complications, so the safety is there. So how can you learn more? What can you do with this information? So if you still have questions or concerns, we recommend you talking to your healthcare provider, especially someone that can really, you know, take the time to answer those questions for you too. And so if someone isn't really taking the time with you, you know, go and talk to a different type of healthcare provider or pharmacist. You can find vaccines in your community at vaccines.gov. And it'll even sort, like if you're looking for specific Pfizer, it'll tell you where you can find Pfizer. If you're looking for Moderna, you can find Moderna. So that's a great website, and it has some information about the vaccines as well. If you haven't gotten vaccinated yourself, you know, get vaccinated and talk to your family about getting vaccinated, all those who are eligible at this time. And consider being a trusted messenger in your community. We have an upcoming 2-part training series about how can you have some more in-depth conversations about the vaccines. How can you answer some of those types of questions that are out there beyond, you know, what we talked about today. And so if that's something that you're interested in, either we might have already gotten an email about it, or you will get an email about it, inviting you to that series. And continue to wear masks and wash hands to add those layers of protection like we talked about with that Swiss cheese model.
All right, now we are going to go through our trusted sources of information. What I'm going to do is walk you through each source, show you the landing page of each link, and kind of explain what each source has to offer. So the first source is from the Ad Council, and this source digs into why some young people may not be ready to get the COVID-19 vaccine. And in this video that we have linked, their friends and family discuss the vaccine and how they can educate themselves and where they can learn more. So if you want to learn more about the vaccine and common concerns, you can visit this link here. Like I said, this is the link to the actual video, and then this is the link to their website. Alright, so this is the Ad Council source, and they have a lot of good information here, and this is what it looks like. The next source is the Greater Than COVID videos. So in this source, doctors, nurses, researchers, and community healthcare workers provide facts that dispel information about the COVID-19 vaccines. They are offered in English and in Spanish, and it's essentially a FAQ video series from KFF and the Black Coalition Against COVID and Unitas US. So here is what the videos look like. And so you can just click on each video and they answer the question that's displayed in the title of the video. Alright. The next source is from the Center for Disease Control and Prevention. So the CDC has a influenza web page, and they also have a COVID-19 web page. So the flu web page answers questions about prevention, symptoms, treatment options, and flu activity and tracking. The COVID-19 web page helps individuals stay up to date with all COVID-19 related information, including the booster shots, vaccine approval for kids, and more. So I can show you what both of these pages look like. So this first one is the flu page. And here's where you get your information on prevention, symptoms and diagnosis, treatment, and flu activity and surveillance. This is the coronavirus webpage. And so here you get your information to help you stay up to date. The next resource is vaccines.gov, which is a tool to help you find the closest place to get your vaccines, including the COVID-19 vaccines and the flu shots. So you just go here to find COVID-19 vaccines, or you can say that you are looking for flu vaccines here. The next resource is the Children's Hospital of Philadelphia Vaccine Education Center. The cool thing about them is, that they are a member of the World Health Organization's vaccine safety net because they meet certain criteria for credibility and content. And on their website, they provide up-to-date and reliable information about vaccines to parents and healthcare professionals. And I can show you what this website looks like. And here's their website. The next resource is Families Fighting Flu. And here on this source provides personal stories about families in flu, and it's an organization devoted to sharing facts, resources, and support to help families better understand the severity of the flu virus. All right. And this is their web page. The next resource is Made to Save, and Made to Save is a national education and grassroots campaign working to save lives by increasing COVID-19 vaccine access, and they are focused on empowering community-based organizations to run outreach programs that increase vaccination rates in communities that are too often left behind by our public health system. Alright, here's the Made to Save website. The next source is the Alanis Foundation videos, and the Alanis Foundation is a local nonprofit organization working on access to flu vaccines after losing their 5-year-old daughter because of the influenza virus. So here, this actually links you to their YouTube page and all of the videos they have to offer. And so there's some Q&A videos and a lot of resources and good content on this channel. The last resource is the Public Health Communications Collaborative, and they were formed in 2020 to coordinate and amplify public health's messaging on COVID-19 and to increase Americans' confidence in the guidance from the CDC. The CDC, state, and local public health officials. So on this link, through this link you can find free webinars such as the Public Health Workforce, Morale, Mental Health, and Moving Forward webinar. So I'll show you what this page looks like. And like I said, you can click over here and you can see some webinars. All right. So thank you so much for watching our presentation. If you have any questions or if you are interested in doing more, you can contact the REACH team at the National Kidney Foundation of Michigan at reach@nkfm.org. Thank you so much.